off then. My name is Catherine Bryan, and I'm very grateful to welcome all of you here today in both my capacity as one of the organizers of the Dalhousie Feminist Seminar Series and also as the chair of the Research Advisory Committee of the Canadian Centre for Policy Alternatives, Nova Scotia office. So before we begin, we would like to acknowledge that Dalhousie University, like the CCPA-NS, is located on the unceded territory of the Mi'kmaq people. More than simple acknowledgement or recognition, however, we offer this as a commitment to the work of meaningful reconciliation and decolonization. The Nova Scotia office of the CCPA opened its doors in 1999 to provide greater balance to public policy in the province. Through our work, we promote a participatory and accountable approach to public policy development, and we propose policy alternatives that aim to move us closer to achieving a more economically and socially just, as well as environmentally sustainable province and Atlantic region. The Dalhousie Feminist Seminar Series brings together faculty and students from across Dalhousie, our colleagues at other institutions in Halifax and elsewhere, and members of the community interested in feminist research and scholarship to present and engage with one another's work in a collegial and supportive environment. The series is organized by Erin Wunker, Asha Jeffers, Eli Manning, and myself. Those are the faces you see on the screen, with support from the Dalhousie Faculty of Health, the Faculty of Arts and Social Sciences, and the Dalhousie Health Law Institute. An archive of recorded events is hosted on hookandi.ca, Fast Feminism, Slow Academe, and a recording of today's talk will also be available on the CCPA-NS's YouTube channel. We will put that in the Q&A. So please use that Q&A feature to ask questions and to offer your own reflections and insights. These are going to form the basis of our discussion, which is going to be moderated by CCPA-NS senior researcher Mary Jean Handy. Dr. Handy is a community engaged researcher and activist who has been studying care work and care policy in the context of globalization and social transformation for more than 10 years. Her recent and ongoing policy research projects focus on aging, immigration, precarious work, and continuing care systems. So before turning it to Mary Jean, who's going to introduce our speaker, please note that live captioning is available by clicking on the CC button at the bottom of your screen. So thank you, Cynthia, and thank you, Mary Jean. I'll turn it over to you now.
Thank you for the introduction. So I'm very pleased to be introducing Cynthia Cranford today. Cynthia Cranford is a professor of sociology at the University of Toronto. Her research analyzes inequalities of gender, labor, and migration and collective efforts to resist them. And she's the author of the book we're going to be talking about today, Home Care Fault Lines, Understanding Tensions and Creating Alliances, which was published in 2020 by Cornell University, ILR Press. Co-winner of the Distinguished Scholarly Book Award from the American Sociological Association's Labor and Labor Movement section. She is also co-author of the book Self-Employed Workers Organize Law, Policy, and Unions, published by McGill Queen's University Press in 2005. And Dr. Cranford's work has been published in several journals, including Critical Sociology, Gender and Society, Gender, Work and Organization, Just Labor, Social Problems, and Work, Employment, and Society, as well as several edited volumes. As someone myself who's researching gendered home care relations, disability, aging, racialized, precarious, transnational work, I find her book is really path-breaking. The demand for home care alternatives has never been greater, and yet the challenge of improving these models for workers and their older and disabled clients through coalition building often seems profound. Dr. Cranford has some really exciting ways of thinking through these home care fault lines, particularly in her proposal of for an intimate community unionism. So without further ado, I'll let Dr. Cranford lead the way, and I really look forward to the discussion that we'll have afterwards. And I'll be watching the chat box. I wasn't doing a good job at that at the beginning, but I promise I will be attentive. So thank you. Off to you, Cynthia.
Okay, great. I'm going to share my screen. are you able to see my screen okay? All right, great.
Yeah, perfect.
All right. I feel like I need to apologize again, but I won't because I don't want to waste more time. So without further ado, home care is in a window into the complexity of inequality, but it also sheds light on the potential for challenging inequalities, like Mary Jean was just talking about, inequalities that result in precarious home care work and poor quality home care services for elderly and aging disabled people who receive them and use them. Now, several studies have argued that alliances between home care workers on the one hand and aging and disabled people who receive home care on the other are really key to achieving both quality care and quality work. Yet in this recently published book, I argue that we also need to recognize and mediate tensions between workers and receivers if alliances are going to be able to tackle structural fault lines reflecting complex inequalities. So how can we arrange home care then to minimize tensions and maximize the potential for alliances? In the book, I tackle this question by comparing how 4 government-funded programs differ in the way they organize home care. And I focus on the most personal in-home support, that is paid help with daily activities like bathing and eating by healthcare aides or personal support workers. So I'm not focusing on nursing care that's recognized as more skilled. So what I want to do in this talk is give an overview of my argument in the book and a peek at one of my case studies, and then talk a little bit about this idea of intimate community unionism that Mary Jean talked about. I was going to say a little bit about COVID, but I probably won't, just so we have time for discussion. We can discuss that if people are interested in the Q&A. So in the book, I use scholarship on aging and disability, labor, domestic work. And I kind of look at all of these different empirical literatures within an intersectional analysis. And so I analyze how people who provide and receive services are marginalized differently, shaping unique interests and experiences. They're located differently within various axes of oppression that form a complex matrix, to quote Patricia Hill Collins' key concepts. Aging and disabled people face marginalization vis-a-vis a state and society that values independence. Some people interviewed for the book had been in care institutions that cast them wholly as dependents, while others feared going into them. Still, many others lacked adequately funded support at home, resulting in their reliance on insufficient family help before receiving home care and even after receiving home care. And in this context, aging and disabled people desire flexible services to fit their varying needs, and they also seek dignity in the interrelationship with workers. Home care workers experience a different face of oppression, to quote Iris Marion Young, one defined by devaluation and lack of recognition within class and gender inequalities. While most of the workers are women, there are some men in the disability support services sector. But the majority of home care workers we know from many studies, especially in the urban areas of rich countries, are immigrant women from poor countries. In these contexts, racialization through nationality, language, religion, culture, skin color infuses economic insecurity, and workers thus seek both fair employment contracts and respect. So juxtaposing these experiences of older and disabled people on the one hand and workers on the other, I argue and consider how a tension between what I call flexibility and security potentially exists across home care programs. Yet my comparative analysis of 4 programs tries to isolate the dynamics that exacerbate or alleviate those tensions. So what I want to do now is just give you my argument, my more empirical argument in a nutshell in relation to some of the care work literature. So with this kind of broader intersectional framing in mind, this tension between flexibility and security, how do I look at this for the case of home care? So I join others that find that government funding based on a narrow medical definition of need on the one hand, and delivery of care through a market logic encourages employers to hire workers on precarious contracts. Narrow funding and this market logic reinforces gendered and racialized labor market inequalities. And this represents continuity with long-standing racialized and gendered divisions of care labor or domestic servitude, as Evelyn Nakano-Glenn argues. Racialized and gendered precarious employment also threatens the quality of services for older and disabled people. So building on this work, my analysis reveals how this narrow funding dovetails with marketization to shape the labor process here. And so it either erases traditional employers altogether or discourages the employers who are present from mediating tensions in the labor process. And these are tensions between workers and receivers about what is done, when it's done, and how it's done. And these tensions are sometimes, as I said, mediated by management, sometimes not. Sometimes management isn't there. It's a direct relationship. So narrow funding coupled with marketization also makes collective action difficult, thus requiring innovative alliances between labor and other social movements that represent the receivers of services. Yet in my comparative analysis, I also show how a broader social funding model coupled with nonprofit delivery can encourage employers to mediate tensions in the labor process and to support workers and clients in negotiating those tensions. And this is in part because these contexts, these nonprofit contexts that have a broad sort of funding model are also more likely to have collective representation of both workers and the receivers. So that's one of the key dynamics. So these essentially are the dynamics that I look at multiple levels that can exacerbate or alleviate these tensions. Okay, so I'll say a little bit about the overall data and the cases in the book, and then I'll go into one of those cases a little bit. So the analysis rests on over 300 interviews, revealing how a variety of players shape the conditions of home care in unique contexts. Over several years, comprising 4 case studies, research teams interviewed personal support workers who were paid to assist with daily activities and aging and disabled people who need this kind of assistance. And we also interviewed caseworkers who assign hours of service, employers, senior disability and labor advocates. We looked at the public documents of the programs. And I also want to here recognize that 2 grants from SSHRC funded the travel, honoraria, community partnerships, and research assistance that made these studies possible. So this chart just gives you some information about the 4 cases. 3 of them are in Toronto, and 1 of them is in Los Angeles. So these are sort of unique contexts that I look at. And so let me just say a little bit about the programs. Direct funding first is a case of individualized and direct funding, which we see also in Europe, in Britain, in continental Europe, and in Britain, and in the US. And here in Toronto, it serves people with physical disabilities. Here, funding is shaped by the social independent living model, which came out of the disability rights movement, which emphasizes non-medical assistance with a wide range of daily activities. The workers are employees of individual self-managers, to use the program terminology, and they are often called personal attendants. As we know, funding for home care is not universal in that it is not guaranteed by the Federal Canada Health Act, but it's not means tested either in this program. So it's sort of left up to the provinces, the funding. And so that's quite very different, as we know, than this in-home supportive services program in Los Angeles, which in the context of the US is funded by Medicaid and is means tested. But it also has some similarities with direct funding in that it's also influenced by this independent living model. But I characterize it as a kind of individualized state hybrid because there are multiple employers recognized under legislation now, and this legislation was actually pushed by an alliance between a union and the independent living movement. And so the state is the employer in terms of funding, but the person who receives the services is the employer in terms of hiring, firing, and supervision. There's also an employer of record that was created to allow for unionization. And also something unique about this program is that, and also why I call it a sort of independent living family hybrid, is that people can hire their own family members, including their daughters or sons, but usually daughters, and their wife, for example, to be their paid provider. Okay. And these are the program terminology. They use consumers and providers. So these individualistic kind of programs are quite different from what is called in the literature a contract agency model. And I have two of those, one nonprofit and one for-profit. So first, the nonprofit ones, Attendant Services in Toronto provides assistance also to physically disabled non-aging people or non-elderly people, let's say, who direct workers to help them with routine daily activities. So again, it's guided by the social independent living model like direct funding and IHSS. But there's this agency who intervenes in the relationship and employs the workers. But here, all the agencies are nonprofits, and the sector is also heavily unionized. Finally, the home care case in Toronto is also this contract agency model, but here all the agencies since the late 90s, most of the agencies are, not all, most are for-profit agencies. And I'll talk a little bit more about that. And also a key difference here from the other cases is that funding is based on a narrow medical model that prioritizes acute over long-term needs. And I'll talk more about that in the talk. You know, the basic service is not means tested, but housework has become means tested, and there's been kind of a cutback even of sort of basic hands-on bodily care. All right, so when I speak of home care generally, like in the title of the book, I include all these cases of state-funded assistance with daily non-medical activities provided to aging and disabled people in their homes. So now I'm going to look at the specific case of home care, what's called home care, as opposed to attendant care or direct funding. So the case of home care illustrates the classic trade-off that we see in the work and employment literature between flexibility for employers and insecurity for workers. Flexibility here also accrues to the government, but not to the home care clients. So let me give you a little bit of context before I talk about the flexibility, security kind of tension and analytic that I analyze in the chapter and in the book more broadly. So in the mid-90s, the federal government cut payments, as many of you I'm sure know, to the provinces, and Ontario responded by restructuring its home care program, introducing managed competition. And this allowed the for-profit companies to come in to compete with the long-standing nonprofits for the service provision contracts. The Ontario Ministry of Health and Long-Term Care funds these services in a medical model premised on cure as opposed to long-term care or chronic illness. The government has sort of justified the move to manage competition by claiming it would provide consumer choice and efficiency, but the effort to contain healthcare costs by closing some hospitals, transferring more medical care to home care, drove restructuring. And in the late 90s, the government rationed in-home long-term care even further by giving priority to acute patients. So in this context, one agency manager that we interviewed said the average client is getting 2 hours of service in a week, which is very, very limited, and a huge number of clients actually get only 1 hour of service. In reference to her single bath a week, Alice, a client, bitterly said, "It's disgusting." Many people we interviewed had experienced cutbacks in services, especially for housework, since the province had shifted it to means-tested service. Family couldn't fill in for all the personal support and housework that had been cut, since women who do the majority of unpaid work, as we know from an extensive literature, were either employed or looking after their own children, or usually both. The government funded Ontario Home Care, but it distanced itself from responsibilities to workers by not only rationing and cutting funding, but also by contracting out these services to these agencies, increasingly for profit. As another contract agency models, the legal employer then is the agency that hires the workers and sends them to clients' homes. But the state funder also hugely influences the conditions, right, through the level and model of funding. In the late 2000s, the government put this managed competition system on hold. And in 2013, it abandoned it, partly due to the critique by unions, by nonprofit providers, and academics. But the workers' and clients' lives were shaped by the system still, in large part through its negative effect on their collective representation. So the government disbanded the voluntary board of directors that managed the earlier home care funding and replaced it with government-appointed executive directors and board of directors, severely reducing input from clients, a trend that continues and is even worse today. Contracting out of services also made it difficult to unionize because our labor legislation is based on a kind of a factory model. It was designed in the post-World War II period, and it assumes a direct and continuous relationship between a worker and a single employer in an institutional or factory or organizational setting, not in a private home. And this is, of course, at odds with home care, especially in this kind of competitive contract model. Several of the nonprofit agencies lost contracts to deliver services, and these were heavily unionized. So this contracting out was essentially a deunionization. Most of the for-profits that gained these contracts were not unionized, although a few large ones have since been unionized. So the lack of significant union presence in the sector, coupled with next to no collective representation for clients, shaped worker insecurity and also limited client flexibility. So I'm going to go into this kind of tension. So I look at flexibility and security at two levels of analysis, essentially, both set within kind of the state level of the model and level of funding. So first, I want to talk about flexibility and security at the labor market level, which is how it's usually talked about in the work and labor literature. So at the labor market level, the flexibility mostly accrued to the agencies. And what I mean by labor market flexibility is the ability to decide and change who provides your services. So it mostly, it was the agencies and the government who had the flexibility, but not the clients. Clients didn't hire their own workers, and agencies didn't accommodate clients' personal preferences in the initial assignment of workers. However, in non-unionized agencies, which are now the majority, clients were sometimes able to switch workers based on highly subjective criteria. Nevertheless, my analysis shows that the degree of clients' flexibility to choose who provided those services was contingent not only on the type of agency, whether it was unionized or not, nonprofit or for-profit, but also the social location of the client. So men or women who were young, who were white, who were born in Canada, or who had class privilege or combinations of these privileges, most commonly were the ones who were felt empowered to ask for a switch in a worker. And the for-profit non-unionized companies were the ones most likely to accommodate the request. So I'll give you an example from one person we interviewed. Gerald, a white man born in Canada in his early 60s, told us that he told the manager about previous issues he had had with workers and said about the new one, "I hope he's got a personality." And in response, the scheduling coordinator told him that if he wasn't happy with the worker, to call them. In contrast, Agatha, an older Jewish immigrant woman, said that the non-union for-profit agency had never asked her about the workers, and she added, "Money talks and I've got no money." So in short, even for-profit non-unionized companies didn't offer this kind of flexibility to most clients, only to those who felt empowered to complain, which was connected with their social location. Within a context of rationed funding, agencies tried to preserve their own flexibility and meet the requests of select clients who complained by defining workers as casual. So the for-profit non-unionized companies were the most extreme in this strategy. All of them except for one who didn't want to answer the question said that all their workers were casual or 100% part-time. They argued that classifying workers as casual and part-time was necessary to provide scheduling flexibility for clients, but my analysis revealed that only certain clients received that flexibility. They also claimed it provided choice to workers, but the interviews with the workers, of course, revealed sort of the negative implications of this, choice of, say, turning down a client, which was insecurity. So when we asked the workers whether they were assigned another client if they lost one, they explained that this was far from guaranteed. Comments like maybe, they try, it depends, and others conveying kind of a contingency and insecurity were common among the workers' descriptions of the implications of losing a client, no matter if they lost the client because they went into long-term care or passed away, or because they didn't want to go back to the client. So one worker, Wenna, summed up this precarity well when she says, waiting to get a client with equivalent hours could be a day, could be a year. We also see insecurity in wages and benefits, and this exacerbated the contingent connections between workers and clients. Notably, home care PSWs earn much less than PSWs in nursing homes and hospitals. A recent study by the Ontario Community Support Association found a 19% wage gap between workers in home care and in the hospital sector, which results to about $11 an hour difference. And also those classified as casual are not fully covered by the basic floor established by the Employment Standards Act in Ontario. So they don't receive things like vacation pay, severance pay, sick pay, paid holidays. Okay, so as I said in the book, in each case study, I analyzed this tension between security and flexibility, not only at the labor market level, but also in the labor process. And so what I mean by the labor process is sort of tensions over what is done, what does the job entail, how it's done, and sometimes when it's done. So I want to illustrate one tension that I identified in the broader comparative analysis. And this I call the tension between time and task. And this is the tension between people's need for a range of services or help with a range of things that could change weekly, could change daily on the one hand. So they want time, not particular tasks, right? Compared to workers who want a job description, who want to know what it is they're going to be doing when they go in there. And so this I call the time versus task tension. So managers, in this context of this sort of rationed funding, this shaped managers' sort of approach to the time versus task tension. So managers formally and informally approached this tension in a sort of a very hands-off way. They described, on the one hand, objective rules regarding what was done. So for example, one manager explains that in the contract with the government, they were only allowed to provide certain services like personal care, bathing, assistance with mobility. And she says, we're not here as a homemaking service, for example, sort of reflecting that kind of cutback of housework and turning it into a means-tested service. PSWs could provide light housekeeping, however, and so this is a gray area. How do you interpret it? The government defined this as the worker cleaning up sort of the immediate area affected by the personal care bodily task. So mopping the bathroom floor after a shower if there was a spill to make sure the client doesn't sort of flip when getting out of the tub. Managers spoke of the care plan as an objective guide to what was to be done, but so not recognizing this sort of subjective nature of what housework is, what is light housework, what is heavy housework, how is housework linked with body work and emotion work. And so they spoke about this as an objective care plan, but they didn't enforce it. They didn't support workers to interpret it or negotiate the tensions around it. So referring to the workers, one manager said, sometimes they don't feel comfortable advocating for themselves or to say no. I mean, there's a lot of that. It's so hard because it's community-based. We try to monitor them, but how can we really monitor? Other managers likewise sort of explained away their lack of intervention and support with reference really to the self-sacrificial woman worker and the difficulty of monitoring home-based services. Rather than proactively supporting workers or clients, they addressed problems ad hoc, or more commonly, they left it up to workers and clients to negotiate one-on-one. But despite this official definition of services as a set of discrete tasks, home care clients wanted and needed, I would argue, flexible support to fit with their changing needs. For example, Eleanor, who was in her 70s and had osteoarthritis and experienced multiple bone fractures, said that the home care worker helped her mostly around the house because she wanted to, quote, persevere and, quote, take a bit longer to do her own bath and her own cooking. So the worker changed the sheets on the bed and did the other laundry and also cleaned the bathroom. And if she had any time, she might dust or something, Eleanor said. Justifying this allocation of tasks and knowing that, housework wasn't really part of the job, she justified it based on need. And she said, I consider what she's doing for me to be personal care. A few clients admitted that workers stayed over paid time to help with the housework and other tasks that had now been defined out of the job. For instance, Claire, a 51-year-old who had incontinence, mental health issues, and difficulties walking, said of her worker, she will stay an extra half hour. That was Eleanor. She will stay an extra half hour, 45 minutes, and she doesn't get paid for it. But the difficulty I have in trying to get my laundry, I mean, there's just no way I can vacuum. Claire, like most clients, was grateful for the worker's unpaid help rather than expecting it or asking for it. But nevertheless, there was extreme amount of unpaid work. Nearly all the workers spoke of providing some services as a favor or of giving a little extra to some clients some of the time. The vast majority gave examples of staying over their scheduled time, and 2/3 explicitly mentioned instances of doing unpaid work at one time or another. But in this context of state-sanctioned and agency-condoned kind of economy of favors, workers did extra for some clients and not others. Nearly 3/4 talked about both giving favors and resisting or stopping, rescinding. So for example, Tala stayed over her scheduled paid time in order to pacify, she said, upset clients, because she said, you can't just leave them, and compassion has a tricky way, she said. But by the time we interviewed her, Tala was adamant that workers should tell their supervisor if the client asked for housework, because otherwise, if you did that, they will be asking for you to do it again. So a gendered economy of favors, which we see in a lot of the care work literature, was under strain, not only due to this rationed funding, but also to racialization in the broader labor market. And the majority of clients we interviewed in this case were white, with many born in Canada, while most of the workers were immigrants from a range of countries in Asia, Africa, the Caribbean, Latin America, and some from Eastern Europe. And these demographics fit with the greater Toronto population. Some workers of color recounted overt rejection from white clients, doors slammed in their face, or racial slurs, and many more experienced being treated like a maid. So for example, Tanis said, some people have never had a Black person come into their home. Some asked her to clean because they did not want her to touch them personally. They might flinch when I go to touch them. They might pull away, Tanis said. Yet she insisted on respect in our interview, stating, we're only human. So this expectation of cleaning when it was no longer part of the job was clearly a racialized experience that was fueled by the manager's sort of hands-off approach and the broader, narrow medical model funding. So can collective representation or voice offer an alternative to these tensions? If unions are to improve workers' conditions in contract employment, I argue in the chapter, they have to reject the kind of narrow business unionism that focus only on workers' issues at the workplace And I talk a little bit in the chapter, I'm skipping ahead here because I'm noticing the time, about how the key union in the sector, Service Employees International Union, did move towards labor market security, even in this flexible model of service delivery. But they weren't able to address these tensions in the labor process because of a legacy of a kind of legalistic unionism that's based on a factory model, what's often called, and is also top-down, not democratic. And it's often called business unionism in the literature. But I want to skip ahead to what I argue in the conclusion. And just before doing that, just to note that none of my 4 case studies achieve flexibility and security at both the labor market and labor process levels. There's no kind of ideal case that I think we could sort of emulate in the other cases. They have different components. Some of them do better at the labor market versus labor process level. Certainly the nonprofit context, because they have more collective representation on both sides, are able to not get rid of tensions, but to help workers and receivers mediate those tensions. But none of them sort of achieve both flexibility and security, this heuristic I'm using, at the labor market and labor process levels. And so what I do in the conclusion is I look to, I compare my 4 cases, and I try to sort of isolate the dynamics that help and those that exacerbate tensions. But I also draw on other cases reported in the literature and some innovative efforts of grassroots labor groups and in alliance with receiver groups for insights. And through that kind of comparative analysis and that look of some of what's been done on the ground, and previous research on community unionism, I come up with this idea of an intimate community unionism, which has 3 prongs, but really in the middle here is this idea that labor needs to ally. And when I say labor, I don't just mean unions, I mean all kinds of worker organizations needs to ally with organizations that represent a diverse group of receivers in a way that is democratic, in a way that allows them to figure out what kind of funding model would be suitable in this sector, what kind of intermediaries can we design to link workers and clients that aren't for-profit organizations that essentially act as temp agencies, profiting off of placing people with each other. And how can we recognize and mediate tensions in the labor process? So just by way of conclusion, I'll say a little bit about these. How are we, just because I clearly have a problem with time, how are we doing on time? Mary Jane.
Well, we've got less than 10 minutes. I don't know if it's possible for us to go over the allotted time.
Yeah, I was thinking perhaps if folks were able and interested, we could stretch it until 1:15 just to make up the 15 minutes. If that works for you, Cynthia. I also don't mean to put you on the spot.
But that works for me.
Okay, thank you.
Okay, so I'll say a few words then about each of these prongs, and then I'll end and we'll have time. So thanks for that. So basically, home care brings together the worlds of labor and social service, complexly interlocking inequalities of race, class, and gender with those of age and disability that are experienced differently by workers and people in need. And so I try in the book to chart the potential for flexibility with security through this comparative analysis, as I mentioned. So I talked a little bit about the overall idea of intimate community unionism, at which the center are these democratic alliances, but let me say something about each of these prongs. So first, these coalitions would push for universal social funding model. Many have talked about the need for universal funding of personal support, especially coming out of the pandemic. We're not out of it, but in context of the pandemic. So as Pat and Hugh Armstrong recently argued in a Canadian Dimension article, it's time to make Canadian Medicare truly universal with a new national plan that goes beyond hospitals to include home care. as well as long-term residential care, pharmacare, dental care. And so I echo those recommendations, which have long been made. But I also draw on these lessons learned from my comparison of the medical model that I talked to you about today with a more independent living model, because I found that the tensions were most extreme in the medical model, given this kind of narrow definition of care that excludes many activities of daily living that people need. So I argue for the need for not just more funding, but for expanded vision of what should be funded, should cover a broad array of physical activities, but also emotional support and housework. And folks like Pat and Hugh Armstrong have also been arguing this for quite a while. So second is this kind of what I call culturally sensitive labor market intermediaries. And so intermediaries link workers and clients. The case I shared today shows how a for-profit sort of intermediary is problematic. They offer, they act like little more than temp agencies. And these kinds of intermediaries are even more important in the two direct hire cases, where there is no agency, right? And the receivers are the direct hiring employers, and where needs are also intermittent. So they might need somebody in the morning and in the evening, but not in between. And they might be at work in between and have somebody at work. So effective labor market intermediaries need to have input from collectivities of the receivers and the workers if they're to meet the needs of diverse groups. So younger people with disabilities are going to need something different than aging Chinese immigrants in Chinatown who want services from Chinese-speaking workers. Labor market intermediaries therefore need to include democratic structures that limit also the discriminatory possibility of personalism in hiring and negotiate the preference that people might have, though, for one who understands their language and culture. These intermediaries could support the extensive paid work by family and friends, but ensure that those family and friends have other jobs, either to combine with their one job to make a living, or to ensure they don't stay in a job because they have no other choices. So academics have noted the need for nonprofit intermediaries, and they do exist in some home care programs, but rarely are they adequately resourced, right? They're rarely funded. So this is why I argue for the need for them to be state funded as well as culturally sensitive, meeting the needs of the diverse workers and clients. So labor market intermediaries are really key to assuring, as I said, that workers don't stay in jobs only for economic survival, but also that people don't keep problematic workers out of desperation. But if we are to ensure that all tensions are not simply displaced to the labor market through firing and quitting, we really need this third piece of negotiating tensions, recognizing them first of all, and then trying to figure out how to negotiate them. So in-home personal support, my analysis clearly shows, includes tensions, some of which stem from the funding model and the organization of the labor market, but others are not necessarily resolved only through better and broader funding or through labor market security and flexibility. We also need to recognize tensions stem from different locations of workers and service users within a matrix of complex inequalities. So the comparative analysis here suggests we need these deeply democratic alliances between workers and service users at this intimate level. And given the bureaucratic tendency of even the most innovative unions, I point in the conclusion to community-based labor organizing for inspiration. And these organizations, especially the feminist ones, are using leadership development, popular education, other methods to grapple with complex inequalities in care and domestic work. So overall, my analysis shows how these democratic alliances between home care users and workers and their organizations, movements, allies, are really what is key to creating the kind of social awareness and also political will to make these multi-level changes in terms of funding in the labor market and in the labor process, if the goal is really to have flexible quality care and secure quality work. So I'll end there. Thank you.
Thank you so much, Cynthia. So I guess we've got about just over 15 minutes for questions. Please feel free to write them in the Q&A box and I can read them aloud. I've got one here from Chi-Cheng Wat, thank you. The question is, we all know about the devastating situation in long-term care homes. This is pandemic related, which is great. Especially during the first and second waves, one thing that is being advocated is highly related to this is the talk of home care. It seems most people want to stay at home. The Long-Term Care Commission also points to the good quality of home care. So what I find really helpful from this talk is the tensions in the labor process that need to be recognized and negotiated, which has really not been talked about among policymakers. How would you envision addressing these tensions, and what would the process be like? How can we implement the process? It's a long question, but it's in the
thank
chat.
you, Chi-Cheng. It's so nice to not see you because I can't see you, but hear you and know that you are here. Chi-Cheng was one of the research assistants that did interviews that didn't feature into this book, but were part of a related project focusing on Chinese immigrant workers in Oakland, California, in Chinatown. And that project was going on the same time as this and really has influenced a lot of my recommendations here at this level of analysis of the labor process. So Chi-Cheng knows some of this, but I will, and it would be great to hear your thinking on this too going forward. Chi-Cheng, I haven't talked to you in a long time, but that project was done in collaboration with an organization called Asian Immigrant Women's Advocates, the long-standing worker center in Oakland, Chinatown, that initially worked with garment workers in Chinatown and some electronics workers. And when those workers when those industries left, those workers and their older age to home care, but they're providing home care in this ethnic economy to elderly Chinese speaking seniors. And this organization has an interesting perspective on who is an employer, what are tensions between employers and workers within the co-ethnic economy, and how are those exacerbated by the broader kind of racialization of the labor market? Because in working with workers in the garment industry, they saw that the contractors were middlemen, right? The contractors would exploit the workers, but they were also inside this larger system of subcontracting. And so they developed campaigns that were both kind of calling the contractors out, but also directing attention to the broader structural forces, and also supporting workers in a kind of really grassroots feminist leadership development model. And that's where a lot of the insight comes from in terms of thinking about how to challenge these tensions in the labor process. First of all, we have to recognize them. And I think that, like you said, Chi-Cheng, they're not talked about. What's always talked about is this tension at the labor market level, because if you don't pay workers well, you can't retain them, and then clients can't have their service. And that's all like hugely important. And that's become even more evidently important with COVID. But I feel, and I've seen this in my other case in Los Angeles, if you do not address these tensions at the labor process level, and not only within ethnic economies, but across race, where they're highly racialized in terms of this, what is the job entail? What is care work? What is servitude? Where is the line between independent living and servitude? And how is servitude been, historically racialized, continues to be racialized? If you don't address that tension, which is there, not to resolve it because it's there, right? But to recognize it and to talk about it, you cannot actually sustain the alliances that you need at the labor market level to push governments for better pay and more secure hours in order to, limit turnover, right? But I also think sometimes these tensions at the labor process are not talked about even by care workers, because they could potentially create fissures in that alliance. in the short term, right? So that's very complicated. So this is a long answer to your question, Chi Cheng, but I just wanted to mention that inspiration of these grassroots feminist worker centers. And also one other inspiration that I have is that there's a group in the US called Hand in Hand, which tries to organize employers of domestic workers to support the domestic workers movement. So for example, to sign on to be good employers and to pay good wages, but they also try to do kind of anti-racism training with those employers. They also talk to workers about ableism, about what independent living means to people, why it's so important to have the flexibility. And so these kinds of organizations it's not surprising that the leader of that organization used to work with the worker center. So these folks, like Mary Jean, who have 2 feet in different movements, who have worked with folks, both workers and receivers, they are doing this kind of, I almost want to say consciousness raising, but that starts there, but this kind of anti-oppressive kind of education work, popular education kind of work, that can help people understand where others are coming from, and that can help build these kinds of long-term alliances that one needs to address not only these tensions in the labor process, but also the labor market and the state level. Thank you, Chi Cheng, for that question.
A really great question and a really great response. Thank you. I think I saw a hand up here, but now I'm not seeing it anymore. And I don't know that there's any other questions in the chat. Is there anyone who wants to, I think I can enable a mic if somebody has a hand up, or you can write your question in the chat. I'm not seeing the hand up anymore, and I'm not seeing any other questions. I wonder, just because we are a little over time, if maybe we should just wrap up there then. I mean, I'm sure we could have lots of interesting conversations about this, but I know, people, it's, the lunch hour in Nova Scotia. And so I guess I'll just thank you again for coming. Cynthia Cranford, and for the organizing with the Feminist Seminar Series. And I'm very happy that the CCPA-NS was able to support this. Thank you. I don't know if you have any closing remarks, Catherine?
Just to thank Cynthia, and to thank you as well, Mary Jean, for all of your work today. And then finally, to draw everyone's attention to our last event, which will be on March 25th. We will be joined by Caitlin Boulding from the University of Washington, and she will be presenting Stomach, Womb, and Soul, Gender Desire in Plato and Hesiod. So I hope that folks will be able to join us for that. And again, thanks to both you, Mary Jean, and to you, Cynthia, for joining us. It was really excellent learning more about your work. Anyway, did you, Mary Jean, want to?
Somebody just put a question in the chat, which looks really great. I don't know if you want to address it now, or if I just put you in contact by email.
Yeah, I mean, it's up to you. I mean, there are actually, there were.
Oh, I see a few. There
are a few questions. Sorry.
Just in the last couple minutes. Yeah. So, do you want to take a couple extra minutes then, Cynthia? You're muted.
Maybe I could just, I don't know, I'm mindful of people's time, but maybe I could somehow just stay on a minute and read these and then contact the folks.
Or I can copy and paste if people want to provide their email addresses, and I can send the questions to Cynthia, or we can give you Cynthia's email.
Yeah, that would be
These
great.
Look like great questions.
Yeah, and I really would, I really like to see, there's some policy things here that I'd like to see. I guess I'll take the cue from you. I think it is the lunch hour, and I kind of have taken a lot of people's time already. Okay, I see the email there. Let me just make sure I have the question.
I'm copying and pasting the questions too.
Okay, great.
Sometimes it takes a few minutes for people to get their thoughts together. And Mary Dan Johnston says that they're interested in the questions and answers. So,
well, I'm happy to stay. I'll take a cue from you.
Yeah, go ahead, because and folks who need to leave can do so. So
yeah, I guess it's more people will hear it than in a one-on-one email, right?
Yeah.
So
yeah, no, this is fine. Yeah.
Shall I just go with the first one first? So
Sure.
Adriana, thanks for the great discussion. Certain unions, although have been mired in reactive patterns, are growing from representing care workers in education and health institutional settings, such as steel workers, who are also often the largest in higher ed among union groups, and are all trying to get their heads around a just transition. Have you had any direct communications with existing unions to broaden coalition? This is a great question. So I interviewed unions for the book and did some follow-up after the book, right before it was going to come out. And so, yeah, I've had interviews with the largest union that represents the home care sector is Service Employees International Union, but also some home care workers are represented by CUPE, Canadian Union of Public Employees, and some are represented by Unifor, which is a general union that used to be the Canadian Auto Workers, and a particular local of Unifor, which has a history of representing precarious workers like garment workers and others. And so I have talked to them, and there are coalitions, mostly between different unions and broader umbrella groups like the Ontario Health Coalition, and mostly those coalitions are pushing for the labor market security that would address the turnover issue, which is key, right? And also broader coalitions just to critique and stop privatization. There were some coalitions in terms of stopping that managed competition model that were really important. And some union organizers in the sort of nonprofit disability sector, in that agency model, attendant services, they talked about also working with some of the nonprofit employers to press an idea to kind of work together to pressure the government for better funding. But there's not, and then there were some coalitions. Most of the coalitions that I learned about were SEIU with client groups, where were the SEIU doing that, with groups like Alzheimer's Society, with other groups representing clients. And again, this was at the labor market level, about retention, about better pay, and how that linked into quality care. Rarely was it at this more intimate level. And so I would argue that though, and often, sometimes when there was a crisis, like a strike or an effort to unionize a place, then these coalitions would be tried to be activated with the client groups. But it wasn't usually sort of directly trying to mobilize the clients to support the workers, right? And so it wasn't very deep. It wasn't very frequent. And so certainly more could be done. But yeah, I appreciate the question about broadening the alliances to include unions, for sure. And then the other question, I recently read about a policy that some cities in Sweden enacted whereby hospitals were fined $700 a day for keeping seniors in the hospital after they were ready to be discharged. Wow, because they needed some care, but no one was at home to help them and there were no spaces. The number of people held in hospitals dropped dramatically, and all parties involved found home care workers to deliver the needed care, and for far less than $700 a day. Oh, time is up. Okay. So yes, I was just looking this morning just at the news and just kind of searching a lot of discussion recently about the lack of wage parity between home care and the long-term residential care and hospital sector, which is exacerbating the crisis of the number of home care workers. And ironically, as home care is always sort of the stepchild, like the supportive, unpaid worker that is never kind of recognized or valued, even though it supports and holds up the healthcare system. So even with COVID, I mean, rightly so, a lot of the dollars were going to long-term residential care, but they weren't going to home care. And this wage parity meant that workers from home care were often taking the long-term care jobs instead of home care jobs. And that was creating even more of a crisis in the number of workers available for home care. So some industry associations of home care employers are saying that they're losing workers to the long-term care and hospital sectors where they're also needed, and that the government really needs to focus on, specific funding dollars to home care, right? And so I guess this is one way that finding hospitals, I guess, would be one way to do it. But that money from the fine, I guess, could be put into actually increasing the wages that would retain and the home care workers and really make them feel valued and respected, and that their job is recognized and important. So thanks for giving me that example from Sweden.
I think those were, I mean, there's a follow-up with Adriana here.
Yeah. U of T is the view greatest growth.
Greatest growth in, yeah, female identified members who are trying to find ways to bring their expertise to the discussion.
Yeah, so one of the things we could think about, one of the questions we could ask is sort of what would home care look like if the women workers who were largely immigrant women workers, racialized women workers, if they were to design the system, what would it look like, right? And the home care workers are rarely consulted in these kinds of stakeholder decisions. I mean, the Ontario government put in this big reform of home care right before COVID, and then quietly it went through in terms of the design. It's kind of complicated, I won't go into it, but lots of stakeholders were not consulted, let alone home care workers and their organizations. And so that's a really important point. And that's why the focus is on kind of the democratic process. I can articulate what I've heard from workers and clients that I've interviewed and from grassroots groups, but really it's those groups that need to figure out the ways that home care should be organized to mediate these kinds of tensions and to alleviate them where possible.
I think there's an interesting example. I don't have it in front of me right now, but there was recently there was efforts to kind of develop home care worker co-ops in Ontario, I think, just small co-ops. And so that's kind of an interesting model for thinking about how to kind of develop this democratic process. But I think it's just a relatively new initiative. So
it is new. I've talked to the woman who's trying to get it started. And yeah, so that really focuses on the labor process, and so workers having kind of control over what the job entails. There is also a cooperative in Los Angeles that the Filipino Worker Center is starting up. And the issue with the cooperative too is finding employers who are willing and able actually to pay a living wage, right? And so they have decided to ally with the Jewish community, partly because there's the Jewish Labor Congress in Los Angeles, which is very progressive. And there's certain rabbis that are very progressive that will speak about, like, and there's a fairly upper middle class community that go to some of these synagogues. So it's a market of people, and that's the market that hand in hand this other organization is trying to tap into. But if we could have government funding people to be able to afford to pay a living wage. You could have this more beyond these niche markets, right? And you could think about a high road of care work and the cooperative model, right? In Los Angeles, the cooperative model, at least in this example, is also desired by many workers who don't have legal papers to work, who are undocumented or in various forms of precarious status, because they're not workers, they're owners, right? And so, but there are different reasons for cooperatives, and the one in Ontario is coming from a very different place, but both of them can fit with this idea of sort of democratic control. Now, how much the clients would have a say in that cooperative model is unclear to me, and clients are different. Some of the clients that they're targeting are not necessarily marginalized clients, right? So yeah, thanks for raising that, Mary Jean. I think that it'd be really interesting to look more at cooperatives, and it's really important to look more at cooperatives because we have the kind of gigification. I don't like to say the name of the company that I almost said to, but we have, apps during COVID that came and are being, touted as this is a way to address the labor shortage, that we can just turn, people into, anyone can be a care worker and they can do that as a side hustle. And that will be great because they can put their picture on there and then the client knows exactly what they're getting. And so to counter this kind of hyper flexibility that would be this kind of gigification of care work, you could have other nonprofit intermediaries who could be cooperatives, but could be small grassroots organizations that have, registries, or like Center for Independent Living has a registry, but it's not well funded, it's not kept up to date, it's not used that much. So there's pieces of different kinds of models. And one of the things is if it's a democratic kind of way of thinking this through, there would be different options for different groups of people, right? For different kinds of receivers of the services, and also for different kinds of workers. And that's where the kind of culturally sensitive point comes from.
Yeah, very, very interesting. I wish we could talk longer, but I do think we have to wrap it up here. Yeah. Thank you again. Thank you to Dal folks. And and I guess there's a few emails in the chat. So I guess, and I've put them, I've copied them down here so you can, follow up with people if you want to continue conversing with people one-on-one.
Great. Thanks, everyone. And thank you for staying a little longer. It was great to hear the questions.
Yeah, thank you. It was a great discussion and an excellent talk. So thank you so much for that.
Bye.
Bye, everyone. Thank you to everyone who stayed. Take care.
Bye.
Bye.